All right. Can y'all hear me? I have everybody on mute, so I don't know why I asked that question. But if y'all can hear me, just wave if you're showing your camera. If not, you can also write it in the text or in the chat as well. Okay, awesome. I see someone with a thumbs up. Okay, thank you. All right. Okay. So we are gonna get started. Um, People are still coming in. I hate starting over, so I may readdress things I mentioned in the beginning. That's why I'm trying to hold off a little bit. But we are almost at 7:05, so we are about to get started. And I thank y'all for coming out. Let me go ahead and share my screen. Okay. So everybody, again, thank you for coming. We're about to get started, but while we're still letting people into the room, in the chat, where are y'all from and what age groups do we have? So I am from Virginia, Newport News, Virginia to be exact, and I am an 80s baby. All right. It's over here. So we have, okay, Petersburg, Virginia. All right. DC, North Carolina, Maryland, 70. Oh, we got 70s, baby. So a few 70s. We got a 60s. I think 70s is in the lead right now. We got 50s, 60s. Virginia's going to be six. Okay. 80s, Virginia, D, 80s, Virginia, 70s. Oh, hey, Dina. Um, we got Maryland outside of DC, 60s babies. DC, Maryland, Virginia, 80s. Okay. All right. So we have some of everybody, kind of. So hopefully this all makes sense for everybody. It comes together for all of the generations we have here. So let's go ahead and get started. So today's the 17th of June. It's 7 p.m. Y'all opted to come to this workshop called the Investigative Medicine and Psychiatry Workshop for Black women experts and leaders. 3 keys to finally getting answers: accurate diagnoses and effective treatment, even when every doctor has told you everything looks quote unquote normal. All right. So if you're here, to make sure you're all in the right place, you're a Black woman expert, leader, role model, and game changer, which means a professional, a business owner, executive, a mom, a sister, a wife, an entrepreneur, an athlete, community leader, an auntie, ages 35 to 64, who's been experiencing persistent, negative, mental and or physical health related symptoms, illnesses, and diagnoses. They're not getting any better despite doing what eventually feels like everything right. Or you've been to multiple doctors, tried multiple medications, done therapy, been told everything looks normal, it's just stress, or maybe been diagnosed with treatment-resistant XYZ. Basically, you feel or maybe even know that something is either being missed, dismissed, overlooked, and you desire a second opinion and or answers. Next, you're done pretending that everything is fine as it pertains to your health, when it really isn't. And you're finally ready to get to the bottom of what's actually going on based on what your mind, your body, and your brain are actually saying. And also, you're a go-getter. You desire change, so you invest in making change happen. For instance, y'all are investing your time with me tonight, so thank you for being here. So this is going to be about 90 minutes. I'll try not to be that long, but it should be about 90 minutes. Within the 90 minutes, the goal is for you to gain a new understanding of why those persistent symptoms, illnesses, and diagnoses have been missed, dismissed, overlooked, ignored, misdiagnosed, or mistreated. You should walk away with the 3-part investigation that I use with my patients to uncover the biological, psychological, systemic, and lifestyle root causes and or contributors of mental and physical illness. And ideally, you'll leave with clarity, validation, and a clear path forward to move from everything looks normal to personalized answers for you. So this should be the flow of tonight's journey. Number 1, why the traditional healthcare misses the mark. 2, the MAP protocol, which is my investigation with my patients. 3, the root cause investigation, which is part 2 of investigation with my patients. Number 4, the rebuild. And then lastly, your next steps. And at the last steps or the next steps, I'm going to give you your live attendee bonuses. All right. As a means of saying thank you for being here. Okay. So more engagement from you all. You can put in the chat or you can unmute. I have everybody muted by nature. Actually, and you should have your videos may have been off when you came in here, but you can cut them on if you like. I put people's videos off because this is medical, healthcare related, even though this isn't a healthcare visit, but just in case people want to keep things private, you're more than welcome to cut your videos off. You're more than welcome to change your name if you like as well, okay? But you should by nature be muted. So you have to unmute in order to speak, okay? All right, so true, false. Oh, we just got more people. 1 second. Okay, true, false. Cancer is the leading cause of disability in the world. So let me see what y'all are saying. Okay, we have no, false, no, false. Okay, false, true. All right. False. Depression actually is the leading cause of disability in the world. In addition, depression is related to physical health issues such as neurobiological or brain disease, heart disease. Oops. 1 second. I'll see that. Things are popping up. My apologies. Metabolic disease and premature death. Basically, uncontrolled and unaddressed mental illness is life-altering and deadly. All right. Number 2, the more medications you try, the more likely you are to find the one that actually works for you. True or false? All right. False. All right, so y'all are pretty good. So the likelihood of finding the medication that works for you actually decreases after the first try, especially when it's chosen randomly. So what this means is that it's important for you to get the medication right on the first attempt based on you and not the quote unquote standard. And I'll get into what the standard is. All right, number 3, if your labs look normal, then that means that your brain and your body is fine and healthy. True or false? All right. All falses. Y'all are correct again. So normal labs in healthcare is not the same for everybody. And it's also not a measurement of optimal functioning or health. In addition, normal and abnormal, from lab results to even how we diagnose people, are primarily based on white populations. So white people are the standard, okay? Number 4, prescription medications should be used as the last line of treatment. Okay. So we have a lot of truths for this one. Let's see. So this one is true or false, okay? Prescription medications should definitely be used whenever needed and appropriate based on multiple reasons. So like how you show up when you come to see us at your doctor's appointments, your test results or lab results, the risk of using them versus the risk of not using them. However, it's important that we all do our due diligence before actually prescribing and before actually taking the medication. Number 5, insurance determines the time, the test, the treatment, the medications, the vaccinations, and the clinicians or doctors that you all have access to. True or false? Okay. So we have a lot of truths. False. All right. So insurance does not actually determine the time, the test, the treatment, the medications, the vaccinations, as of now, the clinicians that you have access to. You always had, and I use the word had because the government's getting into some stuff that's kind of shifting healthcare a bit, but you always had access to these things. However, your insurance does contribute to the awareness that you have of what you have access to. So when you continue to operate within the traditional healthcare system, which is insurance-based and driven, that will definitely determine your health results and your health outcomes. But they do not control what you actually have access to. But they do influence what you are aware of and affordability, let's say. All right. Number 6, racism does not have individual and generational life and health implications. True or false? All right. So yes, it's false. Racism does have individual and generational life and health implications. So racism is equivalent to ongoing trauma, which is equivalent to being in constant survival mode, which is equivalent to your body as constant stress or distress, which is never good. All right. Let me get this chat out the way and tell you who I am. So hi, everybody. I'm Dr. Devin M. Bailey. Family nurse practitioner, psychiatric mental health nurse practitioner, certified functional psychiatry provider, and diplomate of the American College of Lifestyle Medicine. I've been practicing in family medicine, inpatient and outpatient, so in the hospital and out of the hospital, psychiatry and lifestyle medicine for 14 years now. I'm quadruple board certified, so board certified registered nurse, board certified family nurse practitioner, board certified psychiatric mental health nurse practitioner, and board certified in lifestyle medicine. So I've taken a lot of tests because I'm a nerd, I guess. Certified in functional psychiatry. I practice investigative medicine and psychiatry, which means I investigate to identify what the traditional and standard diagnostic process in healthcare constantly misses, dismisses, ignores, or overlooks, especially in Black women. And I'm also a Black woman who has navigated the healthcare system personally and professionally. So I've built my practice to center those who the healthcare system continues to fail, unfortunately. More personally, my nickname is Bug. I went to Virginia Commonwealth University. I'm a member of a professional nursing sorority called Chi Phi Sorority Incorporated. Also a member of Delta Sigma Theta Sorority Incorporated. I think my line sister may be here. I have a Kawasaki Ninja. My favorite Bible verse is Jude 1:24. I'm from Newport News, Virginia. I'm the second born of 5 girls. I have a why not me mindset, a gotta be willing to take the hit in order to get the win sort of mindset. And I never play, when I play something or when I participate, whether it's sports or in life or at work with my patients, I'm going to play to win. All right. So as a disclaimer, because I am a medical professional, I have to say this workshop or you being here is intended for educational purposes only. It does not establish a clinic doctor-patient relationship, and therefore this workshop is not meant to diagnose or treat. Lastly, the examples and patient outcomes I'm going to give are 100% the result of me doing my part as the clinician and 100% the result of the patient doing their part. And the results could not happen otherwise. Therefore, all the results and outcomes are person specific. Okay, so if you've been dismissed, if you've been told to just manage, if you've been handed prescriptions that don't fully work or even cause side effects or other things, I want you to know that it's not you. The traditional healthcare system and the processes are incomplete. So here are some statistics. So 40% of Black women are more likely to die from breast cancer despite similar incidence rates. So if 10 Black women are diagnosed with breast cancer and 10 white women are diagnosed with breast cancer, 4 of those women who are Black are likely going to die, all right? The rate for white women is far less. 64.1%. That's the hypertension or high blood pressure treatment rate, but only 49% are actually controlled. So 64 African Americans are treated for high blood pressure, but only 49% of them actually get to a good level where we can say that their blood pressure is actually good or controlled, okay? 38.5%. Black mental illness treatment rate compared to 57.9% of white people. So 57.9% of white people actually get treated for mental illness or mental health related symptoms, whereas only 38.5% of us only get treatment. All right, so 65%. That is the percent of preventable chronic disease-related deaths in Black women. So let's say we have 100 Black women, 65 of those Black women are going to die from preventable diseases. All right, less than 40% of those women are actually going to die from, let's say, old age. Okay, preventable diseases include heart disease. So that's high blood pressure, high cholesterol, stroke, heart attacks, those sorts of things. Cancer, diabetes, Alzheimer's disease, respiratory or lung disease, kidney disease, and high blood pressure. Those are all preventable diseases, and those are all the diseases that 65% of Black women die from, unfortunately. 7.5 years. That is the biological age difference of Black women compared to white women. And this is secondary to chronic persistent stress. So I just say racism, okay? So what this means is that Black women, although we look good and we keep things moving and what have you, our body age, our heart age, our mind age, and what have you is 7.5 years older than everybody else, okay?
Dr. Bailey, there
Yes.
is a question in the chat.
Oh, thank you. What age is considered, I wouldn't say there's a specific age. However, the people I targeted for this workshop starts at 35. I chose that age because 35 is where things start changing, or where it becomes noticeable to women. So I don't want to say 35 is old, but if we're using this calculation of 7.5 years older, or 35-year-old in age would be what, 42.5 years in body. All right. And again, that's not old either. But if you look at it that way, we unfortunately age faster. I was reading something the other day, some research that said that it is actually safest body-wise and health-wise, our prime to actually have babies is actually when we are a teenager. So we're less likely to die when we have babies as a teenager, which again, that was something I didn't want to read, but that's when it says Black women are at their healthiest. And it's the safest time, even though they're only a teen. All right, so that's the discrepancy between how Black people age compared to white people in America. So 40%, that was a great question. 40%, this is the number of Black women leaders who report burnout. Burnout is essentially mental and physical distress or illnesses. When you start feeling mentally done, physically, your health is going down, that is what essentially burnout is. And 40% of Black women leaders, and essentially Black women are leaders. So that is a lot of us. 96% of CEOs report a decline in their mental health. 26% of executives report, if we have any of them here, report symptoms that are consistent with clinical depression. 7 to 20 years plus is the average life loss of those who experience diagnosed and undiagnosed mental illness, relative to people who are not diagnosed or don't have any issues concerning their mental health, okay? So people with mental illness or mental health related symptoms, whether they're diagnosed or undiagnosed, they do die 20 years younger than everybody else, all right? And this does not account for being Black. So we have mental health, and then we also have being Black on top of that, okay? And the story goes on. Black patients are significantly less likely to receive appropriate pain management, with multiple studies continuing to show in 2026, with healthcare providers believing that Black people don't feel pain, okay? Our skin is thick, we don't feel pain. And this is what medical students and healthcare providers are reporting. So this is from the healthcare point of view, okay? That still is the underlining hints of racism within the healthcare system. Black women experience higher rates of autoimmune disease, and that's where your body attacks itself, such as autoimmune thyroid disease or Hashimoto's or Graves' disease, lupus, multiple sclerosis, with longer, more harmful diagnostic delays than white women. Meaning you can go to your doctor and have the same symptoms of multiple sclerosis, but your doctor, if you're Black, will more than likely not diagnose you early. It will be late diagnosed. And of course, the longer things go on, the worse your health actually gets and the harder it is to recover. Vitamin D deficiency is disproportionately prevalent or higher in Black Americans. So vitamin D deficiency is directly related to mood dysregulation. So like up and down moods, depressed mood, exhaustion, fatigue, inflammation, poor immunity, maternal and fetal health or negative maternal and fetal health outcomes, schizophrenia, reproductive hormone issues such as irregular cycles and uterine fibroids. So vitamin D deficiency is not a good thing in anybody, but especially not in Black people. So everything looks normal, reflects a statistical range of diseases and diagnoses based on white people. So this does not mean when your doctor says everything looks normal, that everything is normal, especially if you're Black. Okay. So this is what's going on behind the scenes of your healthcare experiences. This is the reality of living while Black that I probably didn't need to tell you, but this is the reality of navigating the healthcare system as a Black person, as a woman, and as a Black woman in America. So knowledge plus wisdom. What you do in response to what you know is what has to change in order to save your life, okay? So now I'm going to give you some examples. So this is patient A, and of course I'm changing names and information because HIPAA compliance. But patient A, 43-year-old physician, has 5 years of exhaustion, brain fog, depression, weight gain even after weight loss surgery, on a prescription antidepressant called Lexapro, and nothing worked. But the Lexapro worked the best. When we worked together, what we found: severe vitamin D deficiency, iron deficiency, elevated homocysteine, these are some lab results, depleted ferritin, vitamin B12, vitamin B6, folate, low zinc, inflammation, and low cholesterol. All of these contributing and or even causing the symptoms that she was complaining of: the exhaustion, the brain fog, the depression, the weight gain. So what changed is that we identified the root causes, one of them being poor nutrition, not eating enough and not absorbing the nutrients as a result of weight loss surgery that this person had. What we did was correct the absorption issues in the nutrition, and the investigation and the treatment was matched to what was really going on with the patient and not to a protocol or a book. It was personalized to her. So after 12 weeks, discontinued Lexapro, 100% reduction in depressed mood, 12 pounds lost, energy restored, back to herself. This person was considering early retirement at 43. All right, so this is what I do with,
Dr.
question?
Bailey, there is a question in the chat.
What evidence has been found that says doctors feel Black people don't have pain, or that Black people are pain tolerant? Is in research. Where does this one come from? 1 second. Okay. I will, since you're participating in this workshop, I have your email address. If you're interested, I can send the research to you. So I'll actually supply some of the research, those studies, and attach it to the email. So that way you can read them if you like research. Okay. But yeah, these are things we research over time. People continue to do research just to kind of tell people what is the reality versus what people actually think is happening. This is kind of to show what is actually going on behind the scenes. So this is what I do with my patients, and this is what I feel everybody should do as a clinician, and what patients should be aware of as the patient. So when people come to me, it's because they're experiencing persistent mental and physical health related challenges, illnesses, diagnoses. They're not getting better despite doing what they feel is everything. Okay. So when they come to me, what we do is map the history and the story. Your history and your story are where the clues and the answers actually live. We assess the patterns using the symptoms as signals. Okay. We plot the path. So now that we know your history and your story, we are able to plot the direction of where we want to take this investigation. And then we start the diagnostic process. So let me tell you what that means. Most healthcare appointments start and stop at the symptom. So when you go to your doctor, you complain of a headache, we may tell you to take ibuprofen. So the symptom was a headache. We prescribe a medication that should make the headache go away called Motrin. Okay. But we don't tend to delve further than that. All right. So with this process, we start at the history and the story, because the history and your story is where the answers live. All right. So why this approach is different? the traditional healthcare approach, symptom is matched to the prescription. So again, headache gets Motrin. And you only have 15 minutes from the time that you walk in to the time you walk out. In the traditional healthcare system, we have to see you within that 15-minute time frame from, again, when you check in to when you actually leave the doctor's office. That's the time crunch that we're under in the traditional healthcare system. In the traditional healthcare system, we treat the symptom as the problem. So the headache is the problem, not what's actually causing the headache, okay? We don't have time to look at the patterns. So we don't have time to see what happened, what caused it, what were you doing before, what happens after, that sort of thing. We don't have time to go deep in the traditional healthcare system. So as a result, nobody asks why the symptom is there. And honestly, what we're trained in healthcare-wise, or what schooling and then just in practice, the idea is that we don't want to go looking for something because if we find it, we have to own it, okay? So if I go looking for something and let's say I find something that's potentially life-threatening, but you came in here for a headache, if I find it, I have to take care of it. So rather than do all of that extra, what we kind of are trained to do and indoctrinated in, unfortunately, is to not look, okay? Because it's simpler that way. We can get you seen quicker that way, all right? So again, this is behind the scenes in healthcare. Unfortunately, but that's kind of what it is. As far as the MAP protocol, we established a timeline. When did things start? What changed? What's been going on over time? We treat the symptoms as a signal to investigate the actual source, to find what's actually causing the headache, okay? We use the your patterns over time, so across months, years, and even generations. Symptoms have root causes most of the time, and the questions that we ask seek to find the root causes, okay? And that's the why. Why do you have the headache is what we're trying to get to. So phase 1, map your history. And these are things you can kind of do over or on your own, actually, or with your clinician. So you want to go deep in your timeline. Not just what are your symptoms today, but when did they start? What was happening in your life before? And when it started? What medications have you been on and for how long? What was your mom like? What was your dad like? Are you in a relationship, a romantic relationship? What diagnoses have you been given and by whom? Have those diagnoses ever been questioned? How often do you just sit down and chill? How often do you say no? How many hours do you sleep? How do you feel when you actually wake up in the morning? So we're looking for patterns. And that can be difficult to kind of pick up on when we're only given 15 minutes max to work with you, okay? Or when you don't even know what to pay attention for. Or when the standard is white and you have a Black patient in front of you. All of these things play a role, okay? Assess the patterns. Now it's time. Let me see if we have a question. 1 second. Okay, all right. Now it's time to figure out what's been consistent across time, not just the symptoms, but how you've been responding, okay? So going back to the relationship, are you in a relationship? Why? Or why aren't you in a relationship? How would you describe your current and past relationship? So clearly for me, I get a lot of information based on relationship history, all right? Has anyone ever described you as clingy or distant? Do you have a romantic partner type? How do you feel when you sit down? How do you feel when you say no? Do you feel fine or do you feel guilty or shame? What has worked, even partially? What happens when you take vitamins like B12? Does it make you feel extra hype and anxious? What makes things worse? What patterns, the good, the bad, and the ugly, do you notice about yourself? So here we're identifying recurring themes that tell us where the real problem actually lives. Is this hormone problem? Is it nutritional? Is it brain related? Is it an attachment style? Is it cultural? Is it habitual? Does it involve multiple processes or organs within your body? Is it tied to self-worth or self-value or self-esteem? Is it all of the above? So all of this information, all of these questions are allowing us to recognize patterns and kind of get a feel for where these things might have started and where the actual source may be. Plot the pathway. So now that we have a history, now that we have patterns, now we can see where you're likely headed if you do something and if you don't do anything. Now we can build an investigative roadmap of what needs to be done, what we need to test, in what order, to confirm or even cross off the list potential diagnoses. So is it just a headache? Is it a migraine? Is it a brain tumor? Is it vision loss or vision related? These are the things we kind of need to get in order to know how we need to treat accurately. So this is the phase where those symptoms stop being a total mystery, when the feeling of being difficult or labeled as too much, or thinking that the problem is in your head, or maybe the problem is you, that's when those feelings begin to go away. When we guess, that's how we end up on multiple medications that don't work, or with medication side effects, or with symptoms that continue to persist. And this MAP protocol is how we actually start getting answers. All right. So, for example, we have patient B, a 40-year-old lawyer. When they came, they had been 1 year in the traditional mental health care system, specifically. They were diagnosed with depression and anxiety. They were on 2 medications. Nobody had asked about her history or her story. What we found, her symptoms significantly increased after starting a new high-stress job, but they actually started way back in childhood. So she had been 1 year in the traditional healthcare system. So her symptoms had been getting worse, not getting better for a whole 12 months, but they actually started 40 years ago. So they had been compounding over a 40-year history, okay, without anyone actually connecting the dots. What we did as a result, we were able to discontinue medications. She experienced 100% symptom resolution within 16 weeks, and the MAP protocol revealed what actually needed to be healed with this particular patient. All right. So from the MAP, we get into the root cause investigation, okay? So you've gone to your doctor, you've started to get into your history, what's been going on over time before your symptoms started, and now we're gonna get into the actual investigation, all right? So everything looks normal. Again, it's not the same as optimal or normal for you. The standard, protocols, the lab results, the labs that we order, how we interpret the labs, how we interpret the tests. Again, if you're not white, that standard doesn't apply, but is actually being applied to you. In the root investigation, we perform brain psychiatric baseline testing, and we also do diagnostic accuracy and relevancy review. So what this means is that we actually review the diagnoses, and we're seeing if they're still accurate or if they're still relevant right now, all right? Because typically your diagnoses carry over, and they may be wrong or outdated. So why this approach is different? The traditional healthcare system, basic labs, so a CBC, a BMP, a thyroid test. You're told everything looks normal. Standard reference ranges, meaning, again, the standard is white, and we're ordering labs and interpreting labs. We're diagnosing you based on the standard, all right? Nothing is actually ordered to objectively measure how your body is actually functioning. In the root cause investigation, we do a lot of labs, all right? If applicable. So we're running a full thyroid. So this is T3, T4, thyroid antibodies, vitamin D, B12, ferritin, a COMT, and insulin. The results tell you what's actually optimal for your mind, your brain, and your body based on you, okay? Therefore, you're the actual standard. You are the standard when you're in front of me. If I have a Black person, a white person, Asian, South Asian, Caribbean, whatever, whoever I have in front of me, they're the standard. So that's what I'm measuring them against, okay? Not against someone who doesn't look like them. As a result, the appropriate biological and chemical markers are exactly connected to how your mind, how your brain, and how your body are actually functioning, okay? So the investigative lab panel, so this is the blood work and the test. It goes beyond the traditional standard workup. Depending on your history and your symptoms and how you're presenting, what you're telling me and what I'm seeing, these tests might include, again, a full thyroid panel, a GI map, which is a gut health test, neurobiological or neuropsychiatric testing, so a battery of testing where you're actually taking a computerized test to see where you fall brain health-wise and mentally, and we're getting numbers, we're getting data that we can actually track. Objective neuropsychiatric testing, again, this is the validated psychiatric testing on a computer where we're seeing where your numbers fall so we can actually see how you're doing over time. So we're getting information that we can actually use to see and find out the root cause. And then diagnosis accuracy and relevancy review. So again, we're reviewing your diagnoses, your current ones, your old ones, and even the ones we're coming up with. And we're always testing to see if they still fit, if they're correct, if they're accurate. Are they still up to date, or do we need to cross them off the list? Okay. So patient C, a 38-year-old, a teacher and an entrepreneur. This person was diagnosed with bipolar disorder. They were on a medication for bipolar disorder called an antipsychotic. They were having significant side effects, tardive dyskinesia, and weight gain, actually. What we found when they came to see me instead was multiple nutrient deficiencies, specifically low B12, low folate, low magnesium, low fat or omega-3s. We found a Val-COMT, and all of these lab results were what was actually producing the symptoms that actually looked like bipolar disorder. So her bipolar disorder wasn't primary or wasn't bipolar disorder in actuality. It was nutrient deficiencies. But she was on a medication to treat bipolar disorder and not the nutrient deficiencies. So what we did was we corrected the nutrition. We corrected the B12. We corrected the magnesium. We increased her fat intake. The medication was, of course, discontinued because it was unnecessary. The bipolar disorder symptoms resolved, meaning they went away. But her actual diagnoses were ADHD and complex PTSD. So she had also been misdiagnosed. She was mistreated on a medication that was causing potential permanent side effects, when in reality, her diagnoses were ADHD, complex PTSD, and poor nutrition. So here's an example of a lab result that some of you may have had. When I give you the bonus, it will include those 11 critical labs. This is on the list. This is called a C-reactive protein. This is at a 35.33. So these are some of the results that we find. This is the thing that causes, let's say, when it's in conjunction with other tests or even by itself, this is the thing that causes the heart attack out of the blue. All right. But this is also the thing that people don't pick up on when they see a fasting lipid panel or a cholesterol test, which is common for people to get. The cholesterol may look totally normal and we may say everything is okay. All right. But we didn't check this. And this right here is what causes the heart attack. Okay. That someone didn't see coming because they thought everything was good. These are the things we find. And as you can see, right here, it says low cardiovascular event risk. So what that means is a low risk for stroke or heart attack is less than 1. So ideally, I want my patients less than 1 here. Average, meaning, again, this is the standard. Okay, so average is 1 to 3, and high risk is greater than a 3. This person had a 35.33, okay? Here's another lab that we find, an MTHFR. This person did not convert folic acid. So folic acid, what this means is that the person would take, let's say, vitamin B vitamins, but they wouldn't actually convert it into something that the body could actually use. All right. So this right here is the test that people often have, or the result that people often have, who experience medication side effects, or medications not getting better, or not actually working. Or they may actually experience persistent miscarriages or recurrent miscarriages. All right. This test right here is usually the source of all those things. Some other lab tests that we find. This is a GI map. So this is what's going on in the person's gut. So these are the results, and these are the person's symptoms, which are directly related to these results. So iron deficiency, inflammation in the gut, multiple food allergies. This person's a high risk for autoimmune disease, so that multiple sclerosis and what have you, this person's high risk for that, and also a high risk for colon cancer. And these right here, the streptococcus and what have you, this is what's driving those risks and even some of those diagnoses that, again, you wouldn't find if you didn't test for it. And this is another test where we have toxins that cause things like neurotoxicity, which is brain death or dementia, what have you. We have toxins that cause reproductive toxins, so miscarriages and what have you. We have toxins that cause liver disease and kidney disease, all positive. And these are actually the things that the symptoms or the diagnoses that the person had. So chronic kidney disease, thyroid cancer, they had to get a thyroid removal or a thyroidectomy. They had multiple miscarriages. They also had diabetes and obesity as well. So after we do the investigation, we've mapped the history, we've done the investigation, now it's time to rebuild. We use the information that we have, and now we start making changes based on the information that we have, because now we have some data, now we have some facts. So we start subtracting or removing what's causing harm. We start making adjustments. We start adding things. So whether that's adding more meat or maybe adding a new medication. And we're also improving the person's knowledge and wisdom. So this person is going to be good at using their lifestyle as medicine. They're going to know what's actually going on within their body. They're going to be able to talk to the doctors and feel confident when they're talking to them. And they're also going to be able to confidently make decisions about their healthcare, rather than having the decisions made for them. Okay. So these are all the things that we're doing, because when my patients come to me, I don't want them to stay with me. Actually, I want them to actually go back into the world and to their old doctor and have the information and the confidence that they need to actually get through the healthcare system and be healthy. All right. So why this approach is different? The traditional healthcare system, we usually diagnose, we prescribe, and we expect the patient to comply. All right. And if you don't, then we say you're non-compliant or non-adherent. All right. Because you didn't do what we wanted you to do. As a result, the patient tends to stay dependent on the healthcare system and a passive participant. So we're doing things, we're telling you what to do, and you're expected to, again, follow the rules, but you're not really expected to push back, unfortunately. We make medication adjustments, and sometimes we don't explain why we're doing it, and you actually may not even get better when we're doing it. But again, that's how the system happens. And a lot of times people leave the appointments without fully understanding what was even decided for them or why we came to that conclusion, okay? In the rebuild, my patients co-architect, or we do it together. We build the treatment plan together. So that means the patient does their part, I do my part. I tell them what I'm thinking, they tell me what we're thinking, and we come together to make sure we're on the same page. All right. They become health literate, meaning, again, they know what's going on with their health and they know how to advocate, talk up for themselves. They know how to make decisions, and they know how to be confident when they make the decisions because they understand now what's going on. They know why. Okay. Every treatment choice is explained. So when I prescribe, my patients know what we're doing, why we're doing it, what the goal is. And even sometimes if they want to know, they know what chemicals we're targeting. All right. Depending on how deep the person wants to go. The goal is actual remission. So the goal in healthcare is actually for you to not feel any symptoms, especially when we prescribe. So if I prescribe a medication, the goal is for you to have 0 symptoms. All right. So when people say that they're better, I need them to say that they're gone, not just better. That is the actual goal. Okay. So the patients walk out of every interaction knowing more than they did when they first came in. So again, we subtract. All right. We identify what's not good for you, what's making you feel worse, what's not needed, and we start getting rid of those things. We make adjustments, whether we adjust the medication, we adjust the food, we adjust the exercise and what have you. We start changing things up, switching things up. And then we add. All right. So we add exercise, we add sleep, we add medication, we add therapy, again, based on the results that we have. So we're not doing things randomly. Everything we do has a specific reason. And then we integrate literacy throughout. So again, throughout the program or throughout the work with me, people are learning, they're making decisions, they're becoming confident, they're asking questions, they're getting comfortable with asking questions. They're not feeling like they're combative or they don't feel like they're being dismissed. They become comfortable and confident with their healthcare. So patient D, 58, confined to a wheelchair. This person came to me, they had muscle weakness, dizziness, severe depression. They were on multiple medications. They were told it was a psychiatric or mental health related illness, and they were confined to a wheelchair. What we found was polypharmacy. So this person was on 1 million medications. That's an exaggeration, but they were on a lot of medications, and those medication interactions is what was causing her to not be able to walk anymore. So what we did was we discontinued the medications. We had to do it slowly, but we had to discontinue the medications, and then we slowly restarted only what was needed. So again, this person did end up walking because of medications being removed and physical therapy, okay? But the medications was actually causing the problem. And then we restarted what was actually needed, okay? So they weren't off medications altogether. Some of them were actually needed, but the ones that were causing the issues weren't. All right, so this is another lab test, a MET. So if we hadn't checked this person and gotten this result, or actually if this person had been checked for this first, the doctor who prescribed them Wellbutrin and put them on estrogen and progesterone birth control would have known to avoid that because those things made the symptoms worse. All right. They would have known to not participate in HIIT or high intensity exercise. They would have known that caffeine was not going to be good for them. They would have known that they need to start magnesium. And they would have known that they need to increase or eat more broccoli and Brussels sprouts and bok choy and what have you. Okay. So this lab test was actually creating all the symptoms that the person had. And it was also the reason for them to have a negative experience or side effects from birth control and Wellbutrin. So what we prescribed to help was actually hurting this person because of this lab result. So again, simple lab tests that gives us information first so we know how to safely prescribe and what to do so that the symptoms actually go away and not persist. Okay. So 3 keys one investigative system, all integrated. Your history and your story, doing a root cause investigation or ordering labs specific to what you're actually feeling and specific to the person or you, and then rebuilding. The treatment plan is based only on you, not the protocol, not what we typically do for other patients, not what we typically do for this particular diagnosis, but specifically built for you. Okay, and these are the things that I do with my patients, but these are also the things that I want you to take back to your own doctor and start getting used to asking and incorporating into your own treatment. Okay, because this is what actually changes things. So this is personalization. Without the personalized history and story mapping, the investigation, what we're doing and ordering, has no direction. Without the personalized investigation, when we rebuild, we're choosing things randomly. All right? And without the personalized rebuilding, the information that we found is just information. And whatever we do is not going to work because it's not built on you. So this is what investigative medicine and psychiatry is. Your mind, your brain, and your body finally gets investigated and interpreted based on you, not the standard. Or you're the new standard, actually. Because health and life looks different when your history and when your story is considered. Your lab results get interpreted based on you as the standard. The treatment is personalized to you. And that's the AFIA effect, the name of my clinic. AFIA meaning health, the state of being free from and of physical or psychological dis-ease, illness, or malfunction, wholeness of mind, body, and spirit. Which is the assignment for my clinic, which is 3 John 1:2. Dear friend, it is my prayer that you prosper in all ways, always, and be in good health, even as your spirit prospers. So let's see where we are. So here are some patient reviews, or what they've said. Dr. Bailey's wonderful, incredibly knowledgeable, clinical, and compassionate. Her diagnosis, which no medical professional had been able to do before, was spot on and life-changing. My initial appointment with Dr. Bailey was excellent. The constant conversation, easy to talk to, felt comfortable expressing myself without being cut off or dismissed. She really listened to what I was saying. I appreciate her holistic approach to mental health. Acknowledging that physical elements can also affect your mental health and well-being. She checked my blood work, which is something I haven't experienced with a mental health provider. Dr. Bailey's probably my favorite provider. Her manner is outstanding. Her knowledge and thoroughness is top-notch. So let me pause here because I've been talking a lot now. Which of these, or actually, do y'all have any questions or anything that actually resonated with you about anything I've said thus far? All right, I don't see any in the chat. Okay. So the question now that you may have is, what do you do with this information? Because it was a lot. All right. So again, the
Dr.
MAP
Bailey,
protocol. Oh,
there one question just came up in
do
the
I
chat.
talk God in your sessions? I do. Depends on the patient though. But yeah, if that's something that they want and they're fine with it, we do. If I was to work with you, could you use some of the lab tests yes, ma'am. I don't like to repeat tests. Often I order a lot because I'm family medicine or a primary care provider and psychiatry. So I'm looking at the mind and the body together. So I tend to order a lot of tests that a PCP doesn't order, in addition to a lot of tests that a PCP does order, and then the same for a psychiatrist. So I do order a lot. But if a person already has lab tests done and they're up to date and what have you, yes, ma'am, I do use those tests. And then order what we don't have. So that way we're not repeating stuff. You're welcome. Any other questions? Do you work with people? Okay. I do work with people from different states. I am licensed in Virginia, and that's one of the questions I have. I'm doing a little Q&A at the end. But yes, I do work with patients from other states. But the caveat, they have to be in Virginia though when I work with them. So I have a lot of patients in Northern Virginia, DMV actually. I don't know if I have anyone in like the bordering or North Carolina state or North Carolina cities, but I have a lot of people in Virginia, Northern Virginia, Maryland, and DC. So what they typically do is they just cross the border. Especially if they live like 10, 15, 30 minutes even, they'll cross into Virginia. You're in Bowie, Maryland. I'm not sure how far that is from like the closest city to Bowie, maybe Alexandria or what have you. But yeah, if you're like near, all you have to do is be in Virginia. So you can be in any city in Virginia because I usually do remote or virtual care. So what people will do, they'll come in Virginia and then they'll go back home. So no, you don't have to live in Virginia. You just have to be in Virginia when I see you. If I'm in North Carolina, do you come to Danville? No, ma'am. So I don't do home visits, but if you, I guess Danville is close to North Carolina. In that case, I would say a person would come into Danville, and sometimes they go to a library, just get in a little room, or they're sit in their car, and then we'll talk, and then they'll go home. You just have to be in the Virginia state line, and then I can see you. So that makes it easy for people who want to see me, but they don't actually live in Virginia. So you don't have to live in Virginia. You just have to be here when we talk for an official appointment.
Dr. Bailey, there's a question. Do you work with men as well?
Oh, I do. I
There's
do.
another, okay. Another
Mhm.
question is, what insurance do you accept?
Okay, good question. That's in the Q&A. I don't accept insurance. And I'll get into why I don't. But I don't accept insurance because I'm not traditional healthcare. I worked in traditional healthcare system as a PCP and even psychiatry. And again, those are the 15-minute appointments where the person comes in the door and they have to be out the door within 15 minutes. That's the standard. And I could not keep up with that because I'm thinking too much and I'm ordering too much and I'm trying to figure out what's going on. So I no longer work with the traditional healthcare system, so I don't accept insurance. Well, this
Another
session's
question
recording. Yes,
is,
ma'am. I'm recording it, I hope. I feel like I hit record this time. So I am recording this session and I'm gonna once we're done tomorrow morning, once the recording uploads, I'm gonna send it out.
there
Do you
was
take
one
insurance? Okay.
question for more clarification, Dr. Bailey, about needing a Virginia address. So you don't need one.
Nope. You don't need a Virginia address. Mm-mm. Nope. You just have to be in Virginia when I see you for a clinical appointment. So because I do virtual mainly, unless I have to see you in person, that's another story. But we usually figure that out if I have to see the person in person. But outside of that, most people I don't have to see in person. And again, what they'll do is just drive to the closest Virginia city to them. They'll be in their car, they'll go to a library and rent a room or be in a room and what have you. We'll talk and then they'll go back home. So even their prescriptions I can send to where they are.
Okay. There's another question. Can these tests you order be used with insurance?
Yes, that was in the Q&A as well. So I may repeat some of these answers, but yes, the questions or the labs and the tests, they do utilize insurance if the person wants to utilize their insurance. There are some people who don't want to involve insurance because insurance does mean other people are in your business. But if people don't mind that, we do utilize insurance for like the lab test. If I have to refer you to another specialist, so like another doctor, if I have to order, I do order a lot of like I order, make sure my people's mammograms are up to date, colonoscopies. I do order a lot of ultrasounds and MRIs even if I'm suspecting something and I need to see if something's actually there. Usually insurance covers those as well. So yes, people do utilize insurance. I just don't accept insurance, but they utilize insurance for the things that we're doing.
Okay. The last two questions were related to fees. So how do we find the fees, and do you offer a sliding scale or payment plan?
Yeah, so that's in the Q&A as well. hmm So with the fees, because it's traditional, or because I don't accept insurance, it is expensive. Expensive is relative, so I'm not going to tell people what expensive is for them. But it is out of pocket up front because I don't accept insurance. So that can be expensive for some people. So then, depending on what the person needs, and that's when we get into how people, if you want to work with me, I'll go over that. When I see those people for like the consultation or the clarity assessment call, that's when we discuss your actual needs, and then we decide as far as the fees go, based on what is actually needed and what's not needed. All right. How long is the initial consultation? So I do a clarity assessment call. So that's an initial consultation where we just briefly talk to see what's actually going on and to see if I can actually help you. That's about 20 to 30 minutes. And then if the person wants to work with me, the initial appointment can be like 2 hours. But when we first speak to see if we're a fit and to see if I can actually help them, or if someone else will be best able to serve them, that's about 20 to 30 minutes. But when we actually work together, the first appointment is about 2 hours. Sometimes shorter, sometimes a little longer, depending, but I say 90 minutes to 2 hours.
And Dr. Bailey, can you clarify what you just said as far as referring people to who is best able to help or support them?
Yes. So sometimes I have people, they come to me and what they don't actually need me. They don't need a lot of, well, I wouldn't recommend as the first step, let's say, because they're not necessarily having any persistent or negative or severe symptoms. And again, because it is expensive up front, I'm trying to make sure I'm not doing anything unnecessary for the person. Sometimes what they need is a specialty therapist. And honestly, based on what they tell me, I can kind of figure out what kind of therapist they would be better, they should see or start with first and refer them to them. So that's what I mean by if you don't need me quite yet, that's when I say this person may be best to serve you based on what you've just given me. No, ma'am. The initial clarity assessment is free or complimentary. And that is an access point. So everyone can't work with me and everyone doesn't work with me and everyone doesn't need to work with me. So multiple reasons why we don't work together. But because of what I do, there aren't many people who do it. So talking to me is usually helpful, at least. So that is complimentary. Okay, I don't see any other questions yet. All right. So, okay, so we've kind of talked. So the two paths from here, all right? Either way, path one is to do something, okay? Because again, Black people's health, especially Black women, but Black American health, Black Americans, just overall in America, a lot is going on right now, okay? And things are changing, healthcare related. We talked about the statistics and what have you. So at the end of the day, I just need you to do something. So I talked about what I do with my patients that you can actually do on your own or with your own doctor, okay? Or start getting comfortable speaking to your doctor, okay? Openly. So path number one is you take what you've learned tonight and put it to work, okay? Because the stakes are too high, individually and generationally. You set up an appointment with your own PCP or psychiatrist or whomever you're seeing and ask for the labs that I'm going to give you that I recommend. There might not be always needed, but there are a long list of labs that are typically good, that give good information, okay? If your doctor orders them, hope they're able to interpret them based on you, because again, the standard typically isn't you, okay? So make sure you're the standard when they're interpreting everything that they order. Coordinate your care across multiple specialties. So if you need to see a therapist, if you need to see a lung doctor, a heart doctor, a brain doctor, make sure you're seeing all these people and make sure everyone's talking to each other. And then, of course, learn to better navigate within the traditional healthcare system, which uses insurance. So again, the insurance-driven healthcare system is boxed in, okay? But it is what it is, especially if you have to utilize it. So learn to better navigate within that system, okay? Do what you can, as much as you can within it. And then, of course, path two is actually work with me through the journey back to Afia. So I'll get into that, and that's what we were just kind of talking about. You work inside of a system and a structure and a process designed for depth of investigation that you need. Your map and your investigation is reviewed through a personalized root cause and holistic medicine lens that intentionally centers Black health and you as the standard. The results are written and personalized treatment plan is all written and recorded for you. Oops. And then you become the empowered resource and director of your own health and your own life. And you get good at also using your lifestyle as medicine. I didn't go over what lifestyle as medicine is, but what that is sleep, stress management, make sure I remember them all, nutrition, positive relationships, exercise, and avoiding risky substances. So risky substances, things like alcohol, nicotine, caffeine if it's causing problems, those sorts of things, okay? That is utilizing your lifestyle as medicine. All right, so the Journey Back to Afia is my program, and that's the personalized investigative medicine and psychiatry for Black women experts and Black men, or men, okay, I work with everybody, honestly, but Black women experts, leaders, role models, and game changers who are done accepting everything looks normal as the final answer when they know good and well everything isn't, okay? The Get Your Mind Right, the blueprint, is the first step. All right, so that is the MAP protocol. So that's that long appointment that we have initially, where we're getting your MAP, your history, your story. The initial consultation is what is usually called, let's say. And then we're doing the root cause investigation. So this is where we're doing the blood work and the referrals to other specialists, or the mammograms order, the colonoscopies order, the thyroid ultrasounds order, the MRIs, if necessary. We're ordering those tests to make sure everything that you need is actually being ordered for you, if it's necessary, okay, so we can get information to see what's actually going on and causing you to not feel well, even though you're doing everything you know to be right. The neuropsychiatric computerized testing, the review of your diagnoses and confirming that they are accurate or crossing them off the list rather than carrying them over. And then the results review appointment, where we go over all your results and then start developing your, let's say, treatment plan. And then another 30-day check-in. So the blueprint is about 8 weeks-ish, depending. And then you also get your written treatment plan and updated treatment plan when we check back in, okay? That's the get your mind right, the blueprint. That's the first part of the journey back to Afia. As a result of that, you become the Black woman who finally knows what's happening in your mind, in your brain, in your body based off you. Your history, your story, your biochemistry, your lifestyle, your race, your culture, everything is based on you. You stop wondering what's going on and you start knowing. You stop believing that the problem is you. You stop accepting it's just stress or everything looks normal. You become the wife, the mom, the auntie, the executive, the business owner, the educator, the community leader, whomever you are, that goes hard for her health, or as hard for her health as she goes for everybody and everything else, all because you decided to participate in mental and physical health care done differently against the status quo, which is personalized investigative medicine and psychiatry. And again, some patient reviews. She's the only person who's been able to correctly diagnose me in 36 years of life. When I didn't respond to certain medications, she didn't give up and continued to seek out the root problem. I've seen many other psychiatrists before who hardly listened, didn't ask questions. Dr. Bailey was the opposite. So those women were not the exception. The right investigation, the right diagnosis, the right treatment, and it was only right because, again, it was determined by what their mind, what their body, and what their brain was given. Okay, so again, do these things on your own or do them with me, but I want you to do them because I want you to have a life and health that changes because your healthcare changed, because it was personalized and based on you. All right. So, live attendee bonuses for being here. Let me see if we have a question. How often do you provide these introductions? This is my second one. So I don't know if it was better than the first or not, because I'm still nervous, but hopefully over time it'll get better. But this is my second one. I think I'm gonna start doing these monthly, maybe. If anything, to get better at doing them. And then two, just to give people information about what better healthcare looks like. Okay. Thank you. Thank you. I appreciate it. But yes, ma'am. I plan to do these on a monthly basis, perhaps. But we'll see. Okay. But the goal is to get the information out there, because I don't know if people are really aware of what they have access to, honestly, or what, again, good healthcare or better healthcare or personalized healthcare looks like. Okay. That actually produces results. Okay. So because you are here, live bonuses, all right? So you all signed up. It should have said that you were going to get the 11 critical labs for Black women and reflective health guide. In addition, be off your community. So this is I'm trying to collect interest and see who's interested in it, because this may be where I actually start hosting the workshops, or where I just kind of have like a community where I'm able to kind of give information on a day-to-day or a more regular basis. But I would need to see who would be willing to participate in it, because if it's just one person, that would look like I'm their doctor. So I can't have a few people in it. I would need to have a lot of people, so that way it doesn't look suspect as though I'm practicing medicine. But I'm actually just doing group education. So again, if people are interested, that's information I'm trying to collect and see, but that's something else I'm thinking about offering. So what I want you to do is text the word BeAfia to 757-840-3884. And that's if you're interested in the community, okay? And actually, when you text that, you'll also get the, you should get an automated text that also gives you the link to the labs, that lab, your lab guide and reflective health guide, okay? And then also, let me put it in the chat as well if you don't have your phone. But definitely text. Oh, how do I get back to Zoom? Definitely text me the Be Offie if you're interested in the community for sure. Okay, so this is the guide. All right. So that's your free, your live attendee bonuses for coming. I appreciate you all coming and being here tonight. And then if you're more interested in getting personalized answers, or in that complimentary clarity assessment that we spoke of earlier, where we briefly talk and I kind of see what's going on with you and make specific recommendations, whether or not that's to work with me or not. Okay. If you're interested in that, well, this person came. If you're interested in the complimentary assessment call, then what I want you to do is text the word clarity. All right. So CLARITY to 757-840-3884. And that should give you an automated response with the link to go ahead and fill out that form and get your clarity assessment scheduled. Okay. So if you want to speak directly to me, that's what you want to do. In addition, as another special bonus, if you book your call, if you do the call and you book it within 48 hours, meaning I don't have to see you by Friday. That's not what I'm saying. But if you get on my schedule by Friday, even if it's on the appointment books for next week, if you do it by Friday at 9 p.m., I'm going to give you the list of all the labs that I tend to order for my patients if necessary. And it's a long list. Okay. You'll get that. And then also too, if you decide to work with me, you'll have a $500 gift card to apply towards the blueprint. All right. Okay. Oh no, that should say clarity. My apologies. This should say clarity, not insight. Okay. So text the word clarity. All right. Okay. So question and answers. Let's see what else we got. Interested in compliment. So just, send the word clarity. It might be slow. Where's my phone? And actually, you know what? I can type it here too. Um, and I'll have all this information in the recording as well when I email y'all with everything, just in case we have technical issues. That is the link for the clarity assessment, okay? And again, for that, if you schedule within the next 48 hours, so by 9 p.m. on Friday, you'll get another bonus, and then you'll also get a $500 gift card if you decide to work with me, okay? That doesn't mean I have to see you by Friday. That just means you're on the appointment books to talk to you by Friday at 9 p.m. Okay. Oh, you did it twice. Why isn't it working? Text the word. Is it not working? I got, okay. All right. So it is, okay. So yes. Okay. Awesome. All right. So here are some frequently answered questions that you all actually kind of started answer or actually asked ahead of time. But do you accept insurance for your journey back to Afia? No. So I'm out of network, which means I don't accept insurance, but that's a good thing depending on how you look at it, okay? It allows me to do what I need to do for my patients, to spend more time. So 2 hours with one person for one visit is a lot. That's not allowed with insurance, okay? With insurance, they tell us how often we can see you, how much time we can spend with you, what we can order. There's a lot that goes behind the scenes with insurance. So I don't accept insurance. But patients can use HSA, FSA, credit, Klarna, Affirm, PayPal, debit, ACH for the clinical services, okay? All right. I have Medicare and Medicaid. Can I use either of them? So because I don't accept insurance, I'm not allowed to see people with Medicare or Medicaid, okay? That's something that the government changed. We used to be able to see people with those insurance, then they stopped, okay? So no. So for this one, this is where I really would recommend the Be Afia community. If you're interested, I would recommend just let me know you're interested in that Be Afia community because I can always teach, okay? I just can't see those people clinically, unfortunately, anymore. Can I use my insurance for anything at all? Yes. You can use your insurance for almost everything if you want. So your lab work, when you see another doctor for your MRI or CT scans or whatever I order, if I need to order those for your medications, per your insurance coverage specifications, okay? Do you have to use your insurance? No. Some people, they don't want to use insurance at all, so they don't, okay? That can be expensive, but if they have it like that, they have it like that. So some people don't want to use insurance. When you use insurance, it goes into your record. So whenever we prescribe certain medications, so whether it be like weight loss medications, sometimes it's tricky. Of course, mental health medications, when you get a medication that is along those lines, that can be tricky. It goes in, let's say, your record. And this is kind of the stuff that pops up when you apply for like life insurance. They see these things and then that sometimes becomes a hiccup. So some people just don't use insurance at all. But again, that depends on their ability. But you can use insurance, okay? But that would be some of the reasons why people don't use insurance. And if, let me say that because I talked about specifically about life insurance and mental health and what have you, and just some of those, that area still being stigmatized, unfortunately, even with the healthcare system and life insurance and what have you. I'm listed as primary care and psychiatry. So in my clinic is the Afia Effect Family Healthcare Services. So nobody knows what people are seeing me for. Okay. I did that on purpose. All right. So that people can get around that. So I have FSA, HSA. Can I use either of them? Yes. All right. Usually you may need a letter of medical necessity, meaning why are you going to see this person and why do you need to use your FSA to pay for it? And that just means we need to give you a letter saying you have these symptoms or these diagnoses or whatever, and this is why you're using it. So that's a letter of medical necessity. Why is it medically necessary for you to use it? Not everybody needs that letter, but some people do, and that's what we give you if you do need that. Do you refer to other expert specialists or do you handle everything on your own? I refer to other people. I am an expert in what I'm expert in. My area of expertise and passion is Black health, education, root cause investigation, putting the medical and the psychiatric pieces together, and root cause medicine and psychiatry. That's my passion. That's what I love. So I refer out to everybody else where they are passionate and experts in. So whether it be an expert nutritionist, a psychiatrist, meaning a person sees me for the investigation, and then they take that information to their own person for, let's say, even expense reasons. Direct primary care providers, heart specialists, and what have you. I refer to the person who's going to give you the best care, okay? And that's not me for everything, okay? I'm good at what I'm good with, and everything else, I refer to the other person who's better at it.
Dr. Bailey, a question came up in the chat.
How do you differ from a DPC? With past patients, how would you rate their success lifestyle change when they came to so a DPC. DPC is direct primary care provider. So a primary care provider is what people are more familiar with. They usually use insurance, okay? So if you go to like your PCP, your PCM if you're like military, your family medicine doctor, pediatrician, those are usually primary care. Even like your gynecologist even, you'll know you're seeing a traditional healthcare if you're using your insurance, okay? And if you kind of rushed, okay? DPC or direct primary care, they don't accept insurance. They usually cost maybe like $50 to $80 a month, but you can see them multiple times during the month. They offer a battery of tests that you can get with them. You can spend a lot of time with them because you can see them multiple times. So they're able to do more for you and get you better because they don't accept insurance. But they're usually the ones I recommend as primary care providers because I know they have the time to actually get things done and they're not rushed. So they're going to be able to do more for you and produce better results. I'm not a DPC because I'm not primary care provider. Because I don't see a lot of people in person, I can't do a physical exam. And a primary care provider should always do a physical exam. So I don't function as a PCP anymore. How would you rate their success with lifestyle change? That is one of the harder things for people to do. Some people get used to like, I don't want to say easy, but simpler or easy. So medication works and it works fast, okay? And it works faster than lifestyle changes, okay? And sometimes medication is the first thing to go to, and sometimes it's the thing that people are used to, okay? So when I'm asking someone to eat more, sometimes that can be difficult. So that's a mindset shift, a habit shift. So that actually lifestyle changes take time. But what we're doing is working on them daily, okay? Because it's necessary. So when people come to see me, because they pay out of pocket, they don't really come to waste time. So they know if they're going to pay, they usually follow through. So sometimes it's not as slow as it can be because they're more invested, let me say. Can you repeat the number to text? Yes, ma'am. Let me just write it too. And I think I have that on my last slide too. 757-840-3884.
And Dr. Bailey, some people are texting clarity,
And
but
nothing's
the link
happening?
is not coming through.
That's weird. Okay. I texted that. Well, I tested it. Um,
I do know that you do have the link in the chat, correct?
I put it in the chat. I see some people's is coming through. Let's see. 1 second. My apologies. Let me just make sure. Okay. Hmm. All right. Text me, still text me, okay? And then I'll get that response to you. I'm not sure why it's not working, but I will definitely when you text me, I'll know to text you back. And the text will be from me. Okay? So go ahead and text. The text is coming through. The response is what's messing up for whatever reason. So yeah, go ahead and text me. Okay. Um Okay, do you accept everyone into the blueprint? That's the program if you work with me. So the complimentary clarity assessment call is to for me, you and I to speak. Okay, that's complimentary to see if what you need, what I recommend, if the recommendation would be to work with me or not. Okay. Um, if work with me is the recommendation, do I accept everybody to work with me? No, only if appropriate. And I can only see a few people a month because it's a lot. All right. So again, the blueprint does serve as an access point. It's the investigation at minimum for you to know that you can get answers, okay? The intensive is the step above that where we're actually working more closely together, okay? The blueprint serves as the bridge, whether you work with me or not, to health and wholeness of mind, body, and spirit, or even to the intensive if we continue to work together, all right? But for the most part, the blueprint, I do accept a lot of people because, again, that's the bridge, that's the information. But again, only if appropriate. All right. And again, the blueprint includes the initial evaluation, the investigation in the identifying of the results, and then the diagnosing and the clarification, and then the follow-up visit and what have you. Do you accept everybody into the intensive to work with me past the blueprint? No, because that's even more depth and time. So again, only if it's appropriate and necessary. Sometimes it's not even necessary once we kind of fix everything with the blueprint information we get. Do you have to live in Virginia? We talked about that. No, you don't have to live in Virginia. You don't have to have a Virginia address. You just have to be in Virginia at the time of clinical services. This does not mean you have to be in Virginia when we do the clarity assessment because that's not a patient visit. All right. So you can be anywhere if you want to do the clarity assessment call with me. That's the complimentary consultation. But if you work with me clinically, I'm now your doctor, let's say, then you have to be in Virginia when I see you. Okay. At your nearest Virginia city that borders you. So the financial investment for it, it depends, depending on the need. The Biafia community, if I have enough interest in that, that will be free depending on who said they're interested. And then the blueprint is a cost. The intensive is more expensive than the blueprint. And then the maintenance is cheaper because now we're maintaining. Everything is good to go. So we just need to maintain. Who is the journey back to Afia not aligned with? So it's not good for people who need to use insurance, okay, for everything, all right? Because I don't accept insurance, okay? It's not good for people who are not open to evidence-based medication or medicine or treatment or healthcare approaches, meaning I'm still a clinician, so I have to follow the rules and practice safe medicine, okay? All right, so I can't go extreme and just kind of go off the wall. So you have to be open to following the, I don't want to say standard of care, but you have to be open to me practicing good medicine, okay? If you only want prescriptions, because I use lifestyle medicine and preventive medicine, I'm not the one for you either. And if you don't want to actually invest and participate in your own healthcare, okay? It is good for people who desire to be in thrive mode rather than survive mode, who know that nothing gets better without you and nothing gets worse without you. You're experiencing persistent negative symptoms, illnesses, and diagnoses despite doing quote unquote everything right. You desire to know where you stand health-wise. You desire to improve and identify and prevent what may be coming. You're willing to incorporate your lifestyle as medicine, and you're ready, willing, and able to actively invest in you. And you value individual and generational well-being, health, and prosperity. So some things that I commonly find, this is another question that people commonly ask. Things that I usually find: complex PTSD and secure attachment styles. I would say those are the most popular, most consistent across everybody, honestly. And then some lifestyle issues, so not sleeping, not eating, those sorts of things. Malnutrition, meaning they're not eating enough fat, they're not eating enough protein, they're not eating enough carbohydrates, or they're eating enough, but they're not absorbing it, so malnutrition. Multiple medications and prescription and supplement side effects. And then, of course, your psychiatric diagnoses. That's common because I'm psychiatry too. Sleep apnea is a common finding amongst my patients. Thyroid cancer is common. Chronic fatigue syndrome is common. Autoimmune disease and mast cell activation syndrome is common, especially with my people with migraines. Heart and metabolic disease, so polyendocrine metabolic ovarian syndrome, which used to be PCOS. I'm glad we changed that because that's what it's always been. Oxidative stress and fatty liver disease are common. Chronic inflammation, chronic infection, and reactivation of some infections. So like Epstein-Barr is a big one, honestly, that starts to create issues, especially mental health-wise. Herpes simplex virus is also a big one that tends to start creating symptoms related to mental health as well, and fatigue and exhaustion. Vaginal dysbiosis and gut dysbiosis, that just means disruption of good and bad bacteria and what have you. I usually find a lot of those for people with persistent symptoms. And then your COMT and MTHFR, so how you absorb some of your vitamins. I find that as well. So again, people who work with me, some of the things they've said, very easy to talk to. I feel well cared for holistically. She's interested in ensuring that my plan of care is working for me. Has helped me immensely in just a few appointments. All right. Any other questions?
Dr. Bailey, what about a super bill? I know that you don't accept insurance, but is there a
Oh,
possibility that you can send a super bill to
yes.
your insurance provider?
So a super bill for people so because I don't accept insurance, um, if people have out of network coverage, because I don't accept insurance, that means I'm out of network. Okay. So what some people will do is they'll request a super bill. What a super bill is an itemized receipt from me saying this is what I did, this is what I charged, and it's a receipt for them to give their insurance provider, to see if they can get reimbursed for what they paid. So some people's insurance will reimburse them 100%. Some people's insurance will be reimburse them 5%. So it depends on their out of network coverage. But that is something I do provide people if they want it, an itemized receipt for them to submit to their insurance to get the insurance to pay them back. Good question. Any other questions? Can you send a list of labs again? Oh, yes. Can access, yes, ma'am. I actually wanted to open that too. Uh, all right. Has Care First Blue Choice participated? Um, I'm not even sure. Is that like Blue Cross Blue Shield? I'm not sure because there's so many different types of insurance and then sub-insurance and what have you. I don't even know who is who anymore. But what you would want to do is contact your insurance and see if they provide out of network coverage. Any other questions? All right. So there'll be a post-workshop survey if you, oh, more questions maybe? This has been really great. Oh, thank you. Really appreciate your time in putting this. You're welcome. I appreciate your coming. And thank you for that. There'll be a survey when I hang up. If you want to participate in the survey, it's anonymous on purpose because I want to get feedback to see if there's something you all prefer to talk about. And if a better date works or what have you. So there's a post-workshop survey if you want to participate, and it's totally anonymous. Okay. So that means you can be as honest as you want to be. And all right. So the automated text did not come through for whatever reason. So text me, Afia, and text me clarity if you're interested in that, and then I will respond back to you. Okay? With the information. Awesome. Thank you. I appreciate it. Any other questions? You're welcome. Thank you. I appreciate that. This is what and I put 12 labs. This is what it should look like when you get it. Okay? If y'all can see this. And then I put explanations.
No, your screen is not sharing.
Oh, it's not sharing?
No.
Oh, okay. How do I Thank you. Share. Can you see it now?
No.
No? You
There
see
you
it?
go. Now it's there.
Okay. So this is what this should. Thanks, Dina. All right. But yeah, I will text y'all if you texted me. My apologies for that not working. Not sure what happened with it. All right. I appreciate y'all coming out. I will let y'all know when I have another one if you want to come out again, okay? But yeah, I appreciate you coming out tonight and for asking questions. I like questions, so thank you for asking them and participating and engaging. I appreciate it. All right. Good night. Y'all have a good night. If you have questions too, you can also text that number as well with questions. It's a text, secure text. So you can ask questions there too if you like. Thank you. Thank you. Thank y'all. You're welcome. Y'all have a good night. All right. How do I stop? I see.